this one is what we're going to use for today. We have the face. I haven't named it yet. People have named theirs on my cohort. I haven't named it yet because I just didn't feel like it. I don't like seeing it. So let's say like theoretically, I'm going to be putting in a nasogastric tube. So the procedure would go, you would identify the patient with two identifiers. So like identify you have the right patient and check their armband, making sure that's the right patient. First of all, it's very important for this. You especially want to make sure that they can swallow, because when you put in a nasogastric tube, they have to swallow while you're putting the tube in, because you're going in through your nose. Going in through your nose and it's like into their esophagus, and so it can be very uncomfortable, and you just have to walk them through it, making sure that they understand everything that's going on, because it can be traumatizing and really scary if you don't know what's going on. Someone's like trying to stuff this tube like down into your nose. Go ahead and go with the procedure so I can just show you guys what it's about. So I'd have clean gloves on, perform hand hygiene, and after I've done all of the verifications that this is okay, we can go through with it. There's an order. I'm gonna measure the actual tubing to measure like how much we can actually go into the patient. So we would do it from the nose to the ear. Well, the ear might be further back. Let's pretend it's here. Down to their xiphoid process. So we measure until there. So let's say that we got up until here, hypothetically. So you would take note of where your measurement is. Let's say that's at 40. You would mark it with tape. And then once you have the marking, you can go ahead and you give them some water in case they need to swallow while you're gonna insert the tube. Educate the patient, let him know, okay, Mr. Mannequin, I'm going to be inserting this nasogastric tube. Go through the whole procedure, that this is going into his stomach, and the purpose of it, whether it's to decompress the stomach or to provide feedings for some other order, depending on the doctor's orders. So, all right, Mr. Mannequin, I'm going to go ahead and insert the nasogastric tube. You choose one nostril to put it in, and I'm going to have you tilt your head a little bit to the side. So ideally, it'll be like a little bit like this. Yeah, you can go ahead and do it. So you have your clean gloves on, go ahead and insert. Please swallow. Please continue to swallow as I insert so every time that they swallow, that's when you can put in the tube, because that's when you would want to make sure, that's making sure it's going to go in your esophagus. So you can go ahead and swallow, please. Keep on swallowing. And you would go until you're marked at 40. So yeah, so you have your marker at 40, so you go until 40 because you marked it there. You would put some tape here so it doesn't fall out, because you already went through all this work and the patient went through all of this work to swallow and get this in their esophagus, and eventually their stomach, of course. So you would secure with tape, and then from there you have these two thingies. You would have your syringe. You have like this 60cc syringe or 60 milliliter syringe that you would attach to one of these ports. And then you would take out some of the gastric contents from their stomach. And the reason you're doing this is so that you can test the pH of the gastric contents of the whatever you're pulling out, to making sure that you actually are in the stomach. We can take the contents that we have taken out. You would actually put it back into the patient, because depending on how much you take out, it could really mess with their fluid and electrolyte balance. So you do want to put it back in, and after that we can go ahead and actually secure the nasogastric tube. So you would get like this special sticker, stick it on there, making sure it's like that's there. Mark where you put in your nasogastric tube over here once more, and then secure this to the patient's gown, not their skin, to their gown, with some slack so you can move their head. Secure to their gown, and then this part you leave it open or attach it to a section depending on the doctor's orders. And that's basically how a nasogastric tube is inserted.